Both from Tennessee and from Georgia, and I want to talk for just a minute about what Republicans are for. We've been criticized by the folks on the other side of the aisle for being just against what they're for, and that's not at all true. There are actually 4 other plans that were filed in both the Health Committee and the Finance Committee, the 3 of whom were strictly Republican plans. One was a bipartisan plan that never saw the light of day simply because the folks on the other side of the aisle had their mind made up that they were going to have their plan with a government option, and they were going to do whatever they could to move us towards universal health care coverage. And I want to say to those folks on the other side of the aisle who have stood up and who have said on the floor of this Senate, yes, by putting a government option in place, our intention is for the government to take over health care. Some of them have been very straightforward about that, and they've been honest. There have been others who have been truly is the reason why there is a government option in the plan that we have up for a vote tomorrow night. But what are Republicans for? First of all, everybody in this body is in agreement that we want to drive down the cost of health care, and we want to drive down the cost of insurance, and those are integrally linked. You drive down the cost of health delivery, then you will drive down the cost of health insurance. And there are a number of ways that we can agree today to enact legislation that will help drive down the cost of health care. What are those things? Preventive health care. Well, there's some mention of preventive health care in Senator Reid's bill, somewhere in this 2,074 pages. There is the mention of preventative health care, but there's not the incentive in place to encourage people to move towards preventive health care, like was done in the private sector with Safeway Incorporated, a grocery store chain where the CEO has visited both Republicans and Democrats and talked about the way that Safeway was successful in doing that. We all want to make sure that those who don't have insurance today are covered. We want to cover pre-existing conditions. We want to make sure that we put competition into the insurance market by allowing policies to be sold across state lines. All of those things will work in concert to drive the cost of delivery as well as the cost of insurance policies per se. There's another measure that will significantly improve the cost of delivery, and that is putting in some measure of tort reform. In this bill, this 2,074 pages, that seeks to totally reform the healthcare industry in America today, there is not one mention of reforming the tort system in this country, the malpractice reform area. And if you go to any doctor and you ask him what's the #1 issue on his mind when it comes to reducing the costs in his office, I bet in 99% of the cases, maybe 100%, they're going to tell you that tort reform must be implemented if we're ever going to hope to drive down the cost of the delivery of health insurance in this country. Senator Graham and I have an amendment that we'll be talking about that is a tort reform measure that's a loser pays style of tort reform, and it does not take away the right from anybody who is injured. Anybody who is injured ought to have the right to have their day in court, but it does eliminate the potential for the extensive frivolous lawsuits that our docs and our hospitals have to deal with every single day that drives up the cost of health care. I want to talk too about one other measure that we are for that has been talked about a lot today, and that is covering the uninsured. I think without question, if you want to drive down the cost of delivery and the cost of health insurance, you need to cover those people in this country who need to be covered. We have a little disagreement with folks on the other side of the aisle as to the exact number that they seek to cover with this 2,074-page bill. But there is one area where we do agree, and that is that there's somewhere between 47 and 50 million people in America today who are truly in that uninsured category that we all, as a body of 100, would like to see have affordable insurance available to them. Now, who are these uninsured? Well, first of all, There's about 6 million people in this country today who are uninsured, who are here illegally, and they're illegal, undocumented aliens. Now, folks on the other side, and there's some question about this when you look at the language in this 2,074-page bill as to whether or not they cover those illegal aliens or not, but let's assume we all agree they ought not to be covered. There's another 14 million people in America today who have health insurance available to them from the federal government in one form or another. Either they're Medicaid eligible or they're eligible for some form of SCHIP, the State Children's Health Insurance Program. In Georgia, that's called Peach Care. And for whatever reason, these 14 million people have not taken the initiative to go out and sign up in Georgia in the Department of Family and Children's Services. And I don't know what it is in Tennessee, Senator Alexander, but there is a comparable office in all 50 states for that to be done. What in this 2,074 pages seeks to promote the 14 million people that have insurance available to them today to go in and take that insurance? Nothing. So this 14 million people are not even addressed. Then there's another 15 million people that Senator Isaacson just referred to, and they're people who are either those independent contractors or they're employees who work for employers that don't provide health insurance, but all of them are gainfully employed and they have the ability to purchase health insurance. And some of these are dealt with in this 2,074-page bill. Some of them are not, because if you're an employer with 50 or less employees, then you're exempt. You would not be covered still as a part of that 15 million. Then there's about another 12 to 15 million that I refer to as the hardcore uninsured. And those are the folks that we really ought to try to reach, and those are the folks that the bulk of the $2.5 trillion that this bill is going to cost during the 10 years when it becomes fully implemented seeks to reach. And I would simply say that if we're going to truly have a health reform bill, we need to start and take it step by step. And if the folks on the other side of the aisle are serious about health reform, we can get the appropriate committee chairman together this afternoon, tomorrow, or whenever, and begin work on these issues that I've just laid out there that there should be no disagreement about. And we can move forward with developing a true and meaningful health insurance reform package. And I want to come back in a minute and talk about Medicare taxes and the way that Medicare is going to be dealt with here, but I would simply throw it back to the senator from Tennessee as well as to my colleague from Georgia, because they have both been involved in a very integral way at the state level. Senator Alexander is former governor of Tennessee. Senator Isaacson was an elected member of our state house as well as our state senate. You gentlemen have experience of dealing with Medicaid, and you know what the taxation side of Medicaid does from a state level, and I'd just like to ask you your thoughts on what this 2,074-page bill is going to do to Medicaid in this country as we know it today.
I think